we know that there's been a lot of attention around trauma and resilience, particularly the conversation around adverse childhood experiences. But what's been given less attention really is how human service organizations can actually become more responsive, more resilient, more trauma informed. Now, I've spoken with lots of leaders in the social sector who have a strong understanding of trauma. They were clinicians or they worked with families and youth and adults in some capacity throughout their career. But then all of a sudden, they make a transition from being a clinician or a direct staff member to all of a sudden being in a position of leadership, being a program director or an executive director or CEO. And they might feel a little less experienced, per se, about how to transform an entire organization, a staff of 10, 40, or 100 plus people to become more trauma informed. So, to help answer this challenge, we've invited Brett Loftus to the show. Brett is a human rights attorney, a child advocate, and national expert on trauma and resilience. And in 2018, Brett founded the Center for Trauma Resilient Communities, or the CTRC, where he works across the country to embed and embody the science of trauma recovery and community resilience in organizations. Friends, you're going to love this interview with Brett. I really enjoyed it myself, and I'm excited to be able to share his wisdom with you on this show.
Since we had the kind of seminal adverse childhood experiences study and it's been replicated over and over, I think one of the main learnings we now know is that trauma is common. It is not a them problem, it is an us problem, and it affects so many people. Most of my career has been working with children who are involved with the court system. As a child advocate attorney, that was the first half of my career. And most of those kids were there because there'd been a petition filed, because they were abused or neglected by their families. They were coming into foster care, or they were older youth that may have been involved in some behavior that was really connected to their early childhood trauma that got them in trouble. And so I think the big thing to understand is that it starts, just as we know and the data and the research tell us, is that it starts to develop into some attachment issues early because there's so much attachment related trauma with a lot of kids, which has early learning environments getting disrupted, developmental milestones not happening at appropriate times. And then we start seeing problems in school. And by the time they get in middle school or early high school, they've already experienced so much failure that they start to internalize that failure. And we see behaviors associated with that underlying trauma that then get kids in trouble. And so I think the real issue for all of us in these caregiving and advocacy spaces is to see what's under the behavior and what's really driving. What needs are they trying to get met?
I love the way you shared that as it's not a them problem, it's an us problem, in a sense of we have to learn how to re-see the behaviors that we see. And this goes for, adults all across society. And as we have more awareness around adverse childhood experiences and the effects of trauma, I think as adults, we're starting to get a little bit better of asking the question, not just, hey, this child's behaving in a way that's not working in my classroom, that's not working in my small group or in my after school program or in my sports team, but rather starting to ask that question, what's going on underneath? Roger, if he were joining us today, unfortunately, he couldn't make it today because he had a couple of conflicts come up. And I know he often refers to Dr. Nadine Burke-Harris in this image of the onion, right? As you're kind of peeling back layers, which I think, really hits at some of the themes that you talked about. So you've been working in this field for a long time. So for our listeners who aren't familiar, Brett, can you talk a little bit about your work and particularly your work now at Crossnor? Just how does your organization help youth who are experiencing adverse childhood experiences and other forms of difficulty and challenge when you're providing support?
Yeah, thank you for that question. This is really a story of my career. So I've been doing this for about 30 years. I started as a guardian ad litem, as a volunteer, working with the kids in the court system. And my first real child advocacy job was in a residential program with at-risk kids. And they were there because of a certain set of behaviors, but you start to listen and hear their stories, and you can just write the whole pathway of their life around things that happened when they were very young that were no choice of their own to start to show up for them later. And so I spent the first 13 years after law school as a child advocate attorney in the court system, seeing kids every day that I just intuitively knew had experienced things that I probably couldn't even imagine. And then when the adverse childhood experiences study came out and then subsequent research, it just made sense. And so as my job running a child advocacy nonprofit, a children's law firm, I was pretty much an expert in all the ways you can do it wrong, right? So all the brokenness of every system, child welfare, education, juvenile justice, mental health, all those systems is where advocates really sit at the intersection of what kids need and what they're getting and the big gap between those two things. So I was well versed in all the things that were wrong. What I didn't know a lot about is how do you heal those things? How do you get in front of that? And so that was what drew me to Crossnor. Crossnor Communities for Children has been around for 115 years. And the whole history has been around how do you build an environment to help a kid heal from the things they've experienced so they don't have to carry that into adulthood. And so we work mostly with children who are at risk of coming into foster care, kids who are in foster care, or kids who are aging out or leaving foster care or going to adoptive homes. And we have that whole continuum of services, but the approach is the same. How do we build safe, supportive, responsive environments to help kids heal from things that are pretty hard and that their brains and bodies are really struggling with that level of adversity?
Yeah. And such a great kind of way to think about the whole continuum of services where you might intervene with a child at a different area of the system. You talk a lot about advocates as being this center point of these different systems. I wonder if you could talk a little bit about, what are some of the things that for people who are just entering the field? I have a couple of students at Georgia State and Roger does at UNCC who are also sometimes listen to the podcast and we share information with. But can you just talk about for folks who are kind of new to it, what advice would you give them
Sure.
to helping them kind of navigate some of these systems?
Talking to students is one of my favorite things to do. I love to see an excited young social worker or data scientist or advocate coming into the field. One of the things for them is to really make sure they understand both lenses and mirrors. The lens for them is around what is the paradigm which they're going to look at their clients through. And it can't be their own experience because their own experience is not the same as their clients. And so as we know in trauma responsive work, we're really trying to change the paradigm for what's wrong with you, which a lot of our systems are what wrong with you systems. To what happened to you and what's happening to you. And so really understanding that the paradigm of looking at everyone, whether the behavior is functional or not, and say, what happened? What's really under there? And then how do you take that next step and to be a resilience building force in a person's life to say, what's strong in you? What's strong about the fact that you speak up for yourself or that even if it's not in the way I want you to do it, what's strong about that? And really working on that resilience building lens. So what their lenses are critically important. And that paradigm that you look at your children and your adult clients through. But the other side is really the mirrors. What do you know about yourself? What do you know about your own experiences? What we know is that people in helping professions, on average, have higher ACEs scores than the general population. So people are coming some ways as wounded healers. So doing their own work around what's happened to them, how they're healing, how they're getting the support they need means that they don't perpetuate that with their clients, that they can actually experience healing at the same time as bringing that safety to other people.
This is kind of a good segue into another area of work that you've been working on for the Center for Trauma Resilient Communities. And this notion of how can we build systems, but also support the workforce, engage in training, all those sorts of things. You mentioned so many of people who are in the helping profession come in with some of their own stuff. So can you talk a little bit about your work at the Center for Trauma Resilient Communities and how we're kind of thinking about that?
If this career has taught me anything, it's that I used to think, man, we just get to fix kids and help kids and everything will be fine. And then it was like, well, kids come in the context of family. So we got to work with families. We got to support families, help them heal. And really families come in the context of communities. And we need communities that understand adversity, understand its impact on your mind, on your body, on your spirit. And so when we think about that work, Crossnor for 115 years is building environments to help kids heal. Well, then they go back to another community that's not trauma responsive. And so in 2018, we launched a national initiative called the Center for Trauma Resilient Communities and brought in experts from all over the country as faculty and said, how do we teach organizations how to make that shift to be a trauma responsive culture so they can do this great healing work with clients but not lose themselves in the process. I know way too many helpers who are harmed by the work that they do. They work in a domestic violence shelter all day. They work in rape crisis. They work with child abuse and neglect or with homelessness. And sometimes that's triggering their own experiences. And just the exposure to the secondary trauma can be really damaging. And so how do we build organizational culture that builds protective buffers around ourselves and practices that we all know and use regularly to make our workplaces a place that we can be safe while we do the work that we're called to do? And so we've worked with well over 300 organizations nationwide since our founding, and continue to be really involved in that kind of movement around making our organizations, especially our helping organizations, schools, hospitals, healthcare, nonprofits, to be trauma responsive and healing centered. And that's the work that we do. We love it.
Oh, I bet. In your work with organizations, what are some of the challenges that organizations are facing around this? Because there's been a lot of attention around being trauma informed. And I think a lot of organizations might say, I know we're doing something here.
Yeah.
But maybe they're not doing everything they can be. So what are the common challenges you see organizations facing?
So great question. Some of the challenges really exist in what we are expecting and how we're resourcing people. So much of trauma work has been around just understanding. It's just been that basic knowledge, teaching about ACEs and learning about trauma and like, okay, go forth. And so I ask organizations whenever I meet with them and say, how many of you had a training about trauma? And they all raise their hand. I'm like, how many of you have fundamentally changed the way you do your work? And all the hands go down. The truth is, it doesn't help us to learn about it unless we can learn what to do about it. And so some of the big challenges that people just don't know. How do you work to build an organizational culture that does value the clients and understand the paradigm at which you look to your clients, but also understand that language, the practices, the behaviors that you need as an organizational level to be able to stay safe and healthy in the process of helping? And so that's a really skilled thing. It's one, it's part organizational development, it's part trauma science, but it's also part science of resilience. How do we teach people how to build that buffering and that resilience for the kind of adversity they face on a daily basis? So lots of barriers there just around even what to do next, beyond just another training about some information, and then how to measure it. Like, how do you measure changing in your organizational culture? And there are ways to do that. And that's what we do with organizations to help them see real changes over time.
Oh man, I can't wait. We're definitely going to come back to that part around measuring it too, that change. But I want to stick here just for a moment in the organizational culture piece and talk a little bit about leaders. So, I think a lot of folks will go to trainings. They'll learn more about ACEs. They'll learn more about trauma and resilience. They'll develop certain practices for themselves, maybe, and they'll be conversational with others. But I think then all of a sudden, you find yourself in your career and you're promoted to the level of a program director or an executive director. And all of a sudden you have this new task in front of you, which is you've got 10, 20, 30 staff members who are all doing difficult and challenging work. And you're trying to figure out, how do I best help them help others? So what are the things what are kind of the conversations like between you and other leaders? What are the challenges they're facing, and how can you help those specifically to help bring about that organizational change?
Yeah. I love this question. All the research talks about organizational change and strengthening organization. It really starts with leaders because they have such a disproportionate impact on the organization, either positively or negatively. So this is where we do a lot of work around lenses and mirrors with leaders. So what's your lens on yourself? What's your lens on your clients? What's your lens on your staff? But also, what are you doing around yourself and your own development? What I find is that a lot of us got promoted into leadership roles because we didn't have any boundaries. We worked really hard. We were the first ones there. We were the last ones to leave. I remember times when I took clients home with me, or I gave clients money. Like, I did all kinds of things to help clients. The truth is, I was on a path to burnout, and it was really impacting my mind, my body, my spirit, all those things. And so what leaders don't get trained to do is how to build a healthy, more harmonious or balanced approach to the work. And a lot of that is self-leadership first. If I hear anything, hear that the most important kind of leadership is self-leadership. What are you doing to grow yourself? What does your self-care look like? What is your resilience plan for yourself? Where is what we call squad care? Where is your team? Where's the folks of people? What are you committing to support each other? And then how are you actively building your own resilience so that you can be buffered and show up and do this work over a career, not just for a year or two?
Yeah. And we sometimes as leaders will be hesitant to ask that question because you're, especially in the helping professions, this notion of servant leadership, working, helping others, being the first one in, the last one to go. Sometimes we're unwilling to ask that, of ourselves. What is that we're doing for ourselves to be able to turn around and do that leadership for others. You talked a little bit about being able to measure some of the work or like in the organizational culture around being more resilient, trauma informed, et cetera. So, as you know, we're a podcast focused on data evaluation work, and I want to come back and talk a little bit about how you're doing that at CrossNorth too. But let's focus first on this kind of organizational piece.
Yep.
So, what does it look like to measure an organization's capacity to do this work?
It's really just like any other thing you want to measure. There are scales and subscales that you go in and say, what's our baseline? And then how do we measure this over time and evaluate our progress? We're working a lot with Dr. Laura Brown from Meharry Medical College in Nashville, Tennessee, who developed the Organizational Trauma and Resilience Assessment, the OTRA, which for us, go into an organization, they take a baseline assessment around their own trauma and resilience behaviors and expectations. And then we measure that over time and we look at change. There's also ways to go in and help leaders do self-evaluation. Where are they? Where are they living into the commitments of their own organization? And, SAMHSA and we have some trauma responsive organizational commitments that help with those kind of guideposts along the way. And it's tough. It's tough work. You're having hard conversations about power, around shared governance, around what is real communication. How do we have social responsibility around everybody owning the outcomes and not just one person? So it's tough work and it's great organizational development work to do, but you have to start because we know science tells us it takes 3 to 5 years to start seeing organizational change with the data, but you got to start somewhere.
Yeah. Well, and I love too that you mentioned some of those themes that, if you are a person who's thinking, hey, I'm going to need to do some work organization, you might start thinking about maybe some of the things we think of when we immediately think of trauma resilience. But I don't think people think of communication and shared governance as the first thing that comes to mind when they're talking about that. So can you share a little bit about that too? Like what surprises do you find organizations and leaderships uncover when they do an assessment like this?
Ooh. Well, what they say, if they're really brave and they ask the hard questions, people will give the answers. So one of the things that, we work with a lot of organizations that do domestic violence and rape crisis, which is all about violations of power and control. And we know just from clinical training around parallel process, right? And so if you're not careful, that organization who's working in the space of helping people recover from violations of power and control can start to struggle with power and control. And you've got organizations where working in child advocacy, where kids have been treated terribly, and yet they can start to move to a place where the way they approach kids, the way they talk to them, the way they talk about them, the way they interact with them is showing a lack of respect for the children as humans, right? And so the very thing we don't want to do, sometimes we become if we're not really asking those hard questions. So some of the surprises are, authoritarian leadership, inflexibility, things like not respecting the personhood of the worker, right? They are a person too that has trauma, that has, people expected to lose a family member and show back up at work the next day or not have a livable wage when they're working. I mean, the number of people working in things like housing and homelessness and basic food security who don't make enough money to actually take care of their families and who qualify for public benefits, even though they're working to eradicate that. I mean, it doesn't make sense. There's a lot of structural violence kind of built into the system. And so having those honest conversations, do the people of color feel like they have a voice in your organization? Do the women leaders feel like they are treated at the same level? And this is not about pointing fingers or saying gotcha or any of that stuff. This is about just being really honest about where we are so we can make a plan to move toward a more healing centered, resilient place.
Yeah. And I find in my own work that just having some level of assessment to get a sense of a baseline and understand where you are is like so important to begin that conversation. And I feel the same way. Mine is more focused on evaluation specifically, though sometimes with organizations that do this work. So let's dive into evaluation work a little bit. Going back to the work from CrossNor, you guys have this absolutely beautiful annual report that highlights all the work you've accomplished, supporting schools, community foster homes, serving hundreds of children and families, thousands of therapy sessions. So for nonprofit leaders listening in who might look at a report like that and be like, oh man, we need to have, like our organization needs to have something like that we can showcase our work for. Can you talk a little bit about the work that went behind it to make something like that possible?
Great question. Part of it is that organizations have to invest in the time it takes to look at best practices. So you can't just you start doing something on day one. For instance, we were adopting a new model around trying to prevent children from coming into foster care. And so we did a year-long research project with our staff around what are the best models out there to prevent kids from being removed. We found Home Builders, which is the longest running, most efficacious intervention to keep kids from being removed from foster care. And now we're serving a large part of North Carolina with that model, and the state is contracting with us to do that. But that was a very long process of putting something that had a high fidelity, lots of evaluation components, and organizations sometimes don't take the time to do that well. And so unfortunately, they can't tell you whether interventions are making a difference or not. And we spend a lot of time and effort on things that we're not exactly sure work. And so that time matters. The other is just to really look at where are the kids or families in that system struggling. So one great example, foster care, kids in foster care nationally only graduate a little over 50% of the time. Well, if you did nothing else but work on that outcome, make sure that kids in foster care actually graduate high school. So we measure academic performance and matriculation and high school graduation rates, and then work really hard to get kids into college or trade school, because it's hard to break an intergenerational cycle of poverty, abuse, addiction, whatever, if you don't have education, because a lot of our kids don't have families they can fall back on. And so that has got to be front and center. You have to keep your goals right in front of you and know how you're doing on those goals.
Yeah. Sometimes I've noticed in organizations when you've got a new initiative like that, like Home Builders, for example, and you're starting to get excited about it, and you have staff members who maybe they just don't feel as confident with data evaluation work, or they don't feel, maybe you say the words fidelity for program implementation and eyes glaze over because they're like, what are we talking about here? Kind of how have you worked with your staff to be able to implement these things so effectively and then be able to show results?
Yeah, you got to start small. I really think that so many organizations are trying to do too many things and they can't do them well. And so, for instance, our clinical teams, we're like, look, we want all of our clinicians to be certified in one evidence-based practice. And not all of them have the same interest. I mean, some want to do trauma-focused cognitive behavioral therapy. TFCBT is really important and the data is great and the fidelity is high. But some of them are really wanting to do more equine-assisted therapy or play therapy or some of the different things that have good data behind them also. So it doesn't have to be the same thing for everyone, but you have to start small. What can we do? Well, one of the things that TBRI, Trust Related Behavior Intervention. And so teaching all of our staff around how do you build trust? How do you build safety for kids? Understanding what psychological safety is for folks, for themselves in the workplace. So you don't have to pick everything all at one time, but just start with something and do it well to fruition. Don't give up on it halfway through.
I think that's a good idea, like to sometimes pare things down because, I sometimes engage with evaluation conversations with folks and we start throwing literally everything at the wall. And it gets overwhelming. Like you can't do all of it. You have to kind of figure out what are the most important things. And I really like the way you talked about, if you could just make a difference in graduation rates, it would be huge,
Now,
a huge contribution
now,
for children who are in foster care. I think that's a good lesson for leaders to think about. Maybe not so much doing everything, but just finding the handful of things you need to do well. And also just being able to tailor it to interests. I mean, that people, not all of your staff are going to want to do everything. And letting them develop that specialty and expertise, I think, is so critical.
yeah. We have a staff member who loves to fish. And so he hosts a fishing club for our kids. Anybody that wants to fish, you're not required to do it. You want to do it? Great. He'll take you fishing. That doesn't cost a lot of money. He enjoys it. The kids enjoy it. It's great. And so it really doesn't have to be so complicated. And in fact, we spend way too much time treatment planning and not enough time resilience planning. So a lot of the things that we know through research around building resilience does not necessarily cost a lot of money. Can a kid play soccer in the Y League? Can they take a ballet class? Can they have an opportunity to experience some art because art is their passion? Because we know mastery is one of those great resilience tools, a sense of mastery around something. I'm good at this. This is part of my identity. I can do this. The other is just positive, supportive relationships with non-parents. What about kids having mentors? There are plenty of people out there who want a mentor, partner with a program that has mentors. So it's about piecing together more than just treatment intervention. We've got to think about what are the resilience interventions that every child needs. And honestly, they're the same things that most of us want for our own kids. We want them to be exposed to arts and culture. We want them to play sports. We want them to be in the Boy Scouts or the Girl Scouts. We want them to do things that help them be well-rounded humans. And so much of our effort in the system sometimes are just about trying to reduce symptoms. And those other things really play a part in that.
You just mentioned partnerships and the importance of bringing together, like when we're connecting children, the whole system requires so much of it. And I know that you have such a great experience with developing partnerships with other organizations and community, entities that advance the lives of children and youth. Can you talk a little bit maybe about what you found in your experience as a leader makes for a really good partnership?
Oh, yeah. One of the things is you have to have a real honest conversation about what are we good at and what we're not good at. And so not every organization is good at everything. There are certain things we are great at certain parts of our intervention, but there are other people good at other things too. So I talked about mentoring. We've got a program we partner with that's all about girls empowerment and female leadership. Well, that is a thing that we don't necessarily have all the background in. So they work with our girls and they do leadership development and empowerment with our girls. And it's massive. It's huge. The kids love it. College readiness. We're not experts on college readiness. We run a couple charter schools. We know how to educate kids, but getting them ready for college, there are groups out there that are excellent in college readiness and how to do the FAFSA and how to do your personal statement, how to do what schools to apply to and how to fit, partnering with them. So finding something that's in an organization's wheelhouse. And for me, they have to be excited about working with your population. They can't be trying to sneak you in around the corner or around the edges or throw you a little bit of extra time when they have it. They have to be really excited about working with the population that you have and the children and families that you serve. And that's when the partnership really works well, when there's alignment. And not everybody's not trying to do everything.
Yeah. Well, and what you're hinting at, I think, too, is something that I think sometimes nonprofit leaders are a little afraid to do, which is just to be willing to say no. Like, hey, it sounds like you're not that interested in this, in our focus and our mission, and that's okay.
Yeah.
But maybe we can't pursue this further.
Yeah.
And the ability to say no just opens up so much time and energy for the things that will. That is such an important lesson, I think, for leaders. So we're coming to the end of our show today. And I was wondering if you could share a little bit, Brett, just for those who are interested in learning more about the Center for Trauma Resilient Communities across NORA, how can they find out more?
Yeah, it's just traumaresilient.org. That's all it is. Go there, kind of look at our work, look at the framework that we use. We have an incredible faculty, a really dedicated people. We work all over the country. You just have to start. People think it takes a lot of money to get started. And the truth is, More and more funders, both private funders, foundations, and even government funders, are much more interested about the sustainability of your organization and the sustainability of your workforce. Like, how are you taking care of your people and how are you building for a stronger organization? That's who they want to invest in. And so the resources to do this work are out there. And sometimes we have to help organizations package that so they can explain what are the outcomes, what are the deliverables, what are the learning objectives. We have all that with them. And so some of it just starts with a conversation. What are you trying to accomplish? Are you trying to reduce turnover? You try to do leadership development? What you trying to have a healthier, stronger, more resilient culture? Build psychological safety within your organization? Whatever it is, there are tools to get the folks there. And it's just about starting.
Awesome. Well, I think it's a good place for us to come to a close. Brett, thank you so much for sharing your wisdom with us today.